Hello guys. Today we are going to discuss about a laboratory test called Cholinesterase test. Use of the test to find out if you are likely to have temporary paralysis after being given a muscle relaxant called suxamethonium during surgery, to screen for exposure to organophosphate pesticides. Introduction. There are two similar cholinesterase enzymes in the body: butyryl cholinesterase, found in the blood plasma, and acetylcholinesterase, found in red blood cells. The acetylcholinesterase enzyme breaks down acetylcholine to prevent overstimulation of the nerves. Suxamethonium mimics acetylcholine at nerve junctions, preventing acetylcholine from stimulating the nerves, and is given as a muscle relaxant in anesthetics during some surgical operations. The enzyme butyryl cholinesterase metabolizes suxamethonium. Genetic variations means that some individuals have a genetic abnormality making them deficient in butyryl cholinesterase enzyme. They experience prolonged paralysis and apnea after an operation since they are unable to break down suxamethonium. Prolonged mechanical ventilation may be required to support breathing after an operation. This is often only diagnosed after an unexpectedly prolonged response to suxamethonium after the operation, including during a cesarean section. Other conditions can change the enzyme activity, but deficiency is usually due to gene mutation. Individuals with a deficient butyryl cholinesterase enzyme have no other symptoms aside from a heightened sensitivity to muscle relaxant. Organophosphate pesticides are absorbed through skin, lungs, and gastrointestinal tract. When they bind to red blood cells, acetylcholinesterase, they stop this enzyme from working, and this lead to buildup of acetylcholine in nerves and associated toxicity. The speed, duration, and type of symptoms of acetylcholine inhibition are dependent on the pesticide and route of exposure. Symptoms include vomiting, paralysis, and coma. Organophosphate can also bind to and inhibit butyryl cholinesterase, but the clinical importance of this is less well known. Occupational exposure is most common, but other exposures are possible. Example, eating contaminated food. Butyryl cholinesterase enzyme activity, biochemical phenotype, and genotype are all measured in specialist laboratories. Low total enzyme activity in the blood suggests either an atypical enzyme variant, which would make that individual susceptible to suxamethonium, or acute exposure to organophosphate pesticides. Enzyme inhibitor studies are also used to determine biochemical phenotype. This involves incubating the enzyme under standardized conditions with inhibitory agents such as dubocane and fluoride, and assessing the percentage of enzyme activity that remain. The enzyme activity and phenotype together can be used to give a risk or degree of suxamethasonium sensitivity and need for family studies. Genetic studies may be useful in giving more detailed information. For example, if an atypical variant is difficult for the laboratory to identify, or if a silent gene is suspected. Sample required is blood. Normal range between 8 and 18 units per milliliter. That is about the test. Thank you.